So the very first thing we have to do is start to think about pain from a more broad perspective. If they've had pain for longer than 3 months, this is a quote from Sandy Hilton, who I've taught with for a long time and done some writing with. If they have persistent pain, the tissues are tight, the tissues are weak, or the nervous system is too protective. It kind of boils down to those three things, right? So the very first thing we have to do is take a step back and say, is this actually, and again, we'll go to the pain classification systems as identified by the International Association for the Study of Pain. Is this nociceptive pain? Is it nociplastic pain? Is it neuropathic pain, right? And look at every patient from the beginning through that lens. I think what many of us end up doing is we start with the tissues, and then if that's not working out so well, if we're not able to resolve the problem, then we start thinking about some of the psychosocial factors and the yellow flags. But then when you make that turn kind of halfway through treatment, sometimes patients, I don't know if you've ever had this experience, Mariana, but sometimes patients will say to you, now you're telling me it's in my head.
Mm-hmm.
At first you were treating my disc problem, for example, but now you're telling me it's in my head, right?